They may forget your name, but they will never forget how you made them feel. Maya Angelou. This beautiful quote is such a great description of what we do in healthcare. Often you are seeing patients at their most vulnerable, and the truth is that they won't necessarily remember you, but they will remember how you treated them. Welcome to the needs of the patient. In this presentation, we will evaluate the holistic needs of the patient, identify responses concerning the needs of a specific patient population, and will appraise the needs of susceptible populations. The definition of holistic is when something is characterized by the belief that the parts of something are interconnected and can be explained only by reference to the whole. In other words, this means that when you're considering the holistic needs of a patient in healthcare, it is important that we assess all areas of the patient's life and not just their physical health. Evaluating the holistic needs of a patient includes that connection of the mind, the body, and the soul. Thinking about this connection reminds us of the work done by Abraham Maslow in 1968. Maslow created a model of a human development in the shape of a pyramid. The pyramid shape shows stages of human development that require the bottom stages be met before reaching the top. So let's take a look at those individual stages. The most basic need for humans are physiological needs. This means food, water, oxygen, temperature regulation, the most basic components to sustain life. The next level is safety. These needs refer to the individual's perception that their environment is safe. Love and belonging are next. The social needs that people require, that to feel cared for and to know how to care for others. Next is esteem needs. This refers to someone's positive evaluation of themselves. It is a need to be respected and to respect others. And finally, self actualization. The individual's need to fulfill a purpose. Now, Maslow's hierarchy of needs is important to us in healthcare because we are dealing with patients whose most important needs are at risk. A patient who enters the hospital relies on us to meet their most basic physiological needs. They are unable to do this for themselves, so we offer food, water, etc. Patients are also looking to us to make them feel safe. They are remarkably vulnerable while in the hospital. Making sure a patient does not fall is an excellent example of safety. The love and belonging needs of a patient require us to show the patient that we care. Holding a patient's hand, offering a warm blanket, or even a simple smile will show the patients that we care. When it comes to the higher level needs of the patient, it is important to remember what we learned during our initial discussion about ethical considerations in healthcare. We all have a unique value system that is extremely important to us as individuals. These value systems are an important part of one's culture. To assure we are meeting the patient's higher level needs, such as esteem and self actualization, it becomes very important that you show your patients that you respect their values and culture, even if they differ from your own. Cultural awareness is the ability to first understand our own values and how they shape our decisions and behavior, which we did earlier in the course. Then we must step back and recognize and respect that others have different values that affect their decisions and behaviors. There are many examples of how culture influences patients' response to illness and treatment. For example, in Morocco, family members would not consider leaving a sick relative alone in a hospital room. So the notion of visiting hours, which is very normal for many of us, may be completely foreign to people within this culture. Orthodox and Hasidic Jews can require healthcare professionals and patients not to make physical contact across gender lines. While this may seem different than what you may be used to, this is something extremely important to their culture. Jehovah's Witnesses may decline the transfusion of whole blood or blood components. This choice is not due to a perceived risk, but is based on the interpretation of biblical texts. Patients may refuse to have life-saving surgery due to this belief, and it is our responsibility to respect that decision. There are also dietary customs from various cultures. For example, kosher, halal, or vegetarian menus. Patients are a representation of our diverse population, and it is important to learn about special populations of patients and that will help us recognize their specific needs. As we discuss different patient populations, I ask you to think specifically about the hierarchy of needs and what might be of particular concern when caring for each of these patient populations. Let's start with pediatrics. Pediatrics includes patients between birth and the age of 18. Psychological factors must be taken into account in pediatric patients. An important factor is the ability to use language that the children can understand. Neonates and infants are startled easily, so a quiet environment is essential. No matter the emotional response of the pediatric patient, healthcare workers should not explain to neonates, infants, and toddlers the nature of their condition, the procedure that they're going to have, or complications. All of this information should be appropriately conveyed to the parents of the child. And the reason for that is that child cannot handle that type of information. Remember, most pediatric patients experience anxiety due to separation from the parents and may even have thoughts of abandonment during this time. Being kind, caring, and calm will help all of your pediatric patients. Our next patient population is our morbidly obese patients. This refers to patients whose body weight is 100 pounds or greater than ideal body weight, and who have an increased susceptibility to morbidity and mortality caused by the physical difficulties of carrying the extra weight. Lifting and transporting obese patients presents the first set of challenges. In many instances, the patient requires mechanical lifting devices. This is similar to what you're seeing here. Extra individuals should be available for transport to avoid injury to hospital personnel and to prevent injury to the patient. Obese patients tend to be self-conscious. Therefore, respect for the patient should be given and exposure kept to a minimum when transporting or transferring, meaning be careful with patients' gown. And this should be done with all patients, but be careful with patients' gowns. You don't want to leave people exposed while they're in this vulnerable position of being moved or transferred. Our next group of patients is our diabetic patients. Diabetes is a genetic endocrine disorder that affects how the body uses blood sugar or glucose. There are two types of diabetes. Type 1, which is insulin-dependent diabetes, where the pancreas produces little or no insulin. These individuals must have daily regular doses of insulin. And type 2 diabetes is where the pancreas produces different amounts of insulin. The patient may not be required to take insulin, and blood glucose levels are usually controlled by diet. An increased rate of infection is one of the most common complications of diabetes, and this is due to the diminished levels of blood flow in these patients. Our next group is immunocompromised patients. Typically, these patients include the old or very young. There are also certain chronic diseases that target the immune system and decrease the body's ability to fight off infection. The immunocompromised patient may experience symptoms such as skin rashes, skin lesions, painful joints, or poor nutritional status. These symptoms may require physical and emotional support to the patient and the patient's family members. Physically challenged or sensory impaired patients may be physically, developmentally, or mentally impaired. Healthcare workers must be aware of the psychosocial and physical needs of these patients. For example, patients with hearing impairments will have different needs than a patient with a visual impairment or than a patient with a developmental impairment. Nonverbal communication is very important, and a gentle touch or a smile goes a long way in providing comfort, in providing a comforting emotion to the patient. Patients in isolation have precautions to prevent the transmission of infection while in the hospital. The basic fundamentals of care of the isolated patient include frequent hand washing, wearing masks, eye protection, gloves, and gowns. Geriatric patients are individuals who are over the age of 65 years. The typical older patient may have some form of chronic debilitation or decreased physiologic status. Elderly patients are often arthritic and suffer from restricted movements of extremities and fragile skin that requires special consideration when lifting, transporting, and positioning. That fragile skin means that it can tear easily, so we should always use extreme caution. Due to cardiovascular issues, elderly patients can become easily hypothermic or cold, so warm blankets are often welcome. Substance abuse patients have issues with substances such as alcohol, illegal drugs, or prescription drugs. These patients can be quite a challenge as they may also exhibit behavioral problems. Often the substance abuse patient's behavior can range from violent to calm to catatonic, and this would all be based on the patient's drug of choice and how much has been ingested. Many substance abusers also suffer from coexisting psychiatric illnesses such as anxiety disorders, panic disorders, depression, and bipolar syndrome. The presence of a counselor or social worker will be beneficial to the team, the healthcare team, and the patient. Post-traumatic stress disorder, or PTSD, can develop after exposure to a traumatic event such as sexual assault, warfare, traffic collisions, child abuse, or other threats on a person's life. While the level of PTSD varies from patient to patient, the symptoms are similar. These may include flashbacks, the inability to interact socially, and this would be the avoidance of people, and sleep disorders. The patient may be irritable, angry, or aggressive, or have poor concentration. It is recommended that a counselor is also available during the patient's care. The healthcare team should avoid loud noises and approach the patient calmly and slowly to create a non-threatening environment. So after hearing about all these different types of patient populations, how do we help patients to the best of our ability when each of them requires such individual specific treatment? First, we must establish clear communication. Make sure you know your patient's preferred method of communication. English, Spanish, sign language. Make sure you arrange professional interpretation if necessary. After you've established communication, get to know your patient. Use active listening skills, ask questions, learn about the specific needs of your individual patient. Ask openly about potentially relevant traditions and customs. This includes exploring potential spiritual or religious practices. dietary considerations, and cultural norms that may be particularly important to your patient. And finally, examine your own biases. We all have unconscious bias and prejudices that impact our relationships with patients. For example, judging a patient suffering from substance abuse because of an experience you had in your personal life is not okay. It's very natural, it's very human, but it's something that we have to be aware of so that we don't do it. A good healthcare worker identifies and understands their own biases so they can control them. This will allow you to treat every patient with the individualized, holistic care that they deserve and that they need to heal.